JD Vance just delivered the biggest win for working Americans in decades. A $4,950 Social Security boost plus $1,200 health bonus that starts processing next week. And the establishment politicians who've been robbing you blind are absolutely losing their minds right now. This isn't some campaign promise that disappears after Election Day. This isn't another Zhengzhujia telling you to wait until next year. This is real money hitting real bank accounts for people who've been getting screwed by the system for far too long. If you've worked your entire life, paid into Social Security, and watched your buying power disappear while politicians got rich, what I'm about to tell you will restore your faith that someone actually gives a damn about working Americans. But here's what they don't want you to know. There's a specific income threshold that determines whether you get the full amount or get nothing at all. And there are 3 actions you must take before Friday to guarantee your payment. Miss these deadlines, and you'll be watching your neighbors get money that should be yours. This affects 47 million Americans receiving Social Security, plus another 12 million who qualify based on work history alone. We're talking about people who built this country: factory workers, teachers, nurses, truck drivers, small business owners who played by the rules and got played by a system designed to enrich the connected while leaving everyone else behind. The timing isn't coincidental. Vance pushed this through because he knows families are making impossible choices right now. Your Social Security check that used to cover basics now barely pays rent. Groceries cost double what they did 3 years ago. Prescription drugs are bankrupting seniors who worked 40 years to earn a decent retirement. While career politicians were debating abstract policy, Vance was looking at the numbers that matter. 73% of Social Security recipients have less than $1,000 in savings. 42% are choosing between food and medication. And the average retiree has seen their purchasing power drop 23% since 2020. Here's exactly what Vance delivered and why this is different from every other politician's empty promises. The $4,950 Social Security cash bonus goes directly to anyone currently receiving Social Security retirement, disability, or survivor benefits with monthly payments between $800 and $3,200. That covers the vast majority of recipients, the working-class Americans who paid into the system their entire lives but never made enough to max out their contributions. "We're not means testing this to death," Vance told reporters yesterday. "If you worked, if you paid in, if you're trying to survive on a fixed income while everything gets more expensive, you deserve this money. Period." The $1,200 health bonus targets the crisis nobody talks about: Americans rationing medication and skipping doctor visits because healthcare costs are destroying family budgets. This money comes with no restrictions. You can use it for prescriptions, dental work, vision care, or any health-related expense. No forms, no pre-approval, no bureaucrat deciding whether your pain is legitimate. But here's what makes this different from typical government programs. It's funded entirely by money that was already being wasted. Vance identified $347 billion in redundant federal spending, overseas aid to countries that hate us, and subsidies to corporations that shipped American jobs overseas. Instead of giving that money to foreign governments and Fortune 500 companies, it's going to Americans who earned it. The payment structure is designed to help people immediately. If you receive Social Security on the second Wednesday of the month, your bonus comes the following Monday. Third Wednesday recipients get theirs the following Tuesday. Fourth Wednesday recipients get theirs the following Wednesday. No waiting months for bureaucrats to process your application. This isn't welfare. This isn't charity. This is returning money to people who earned it through decades of work while watching politicians waste trillions on everything except the Americans who actually built this country. The health bonus recognizes something Washington refuses to admit: Healthcare isn't just expensive, it's designed to extract maximum profit from people who have no choice but to pay. A 2023 study showed that 34% of seniors are rationing insulin, 28% are skipping cancer screenings, and 52% have delayed dental care because of cost. Those aren't statistics. Those are American heroes dying because the system prioritizes corporate profits over human lives. Vance didn't just identify the problem, he solved it. We calculated that $1,200 covers the average American's annual out-of-pocket health expenses that insurance doesn't cover, he explained. This isn't enough to make anyone rich, but it's enough to let people get the care they need without choosing between medication and groceries. The contrast with previous administrations is stark. When politicians needed money for foreign wars, they found trillions overnight. When banks needed bailouts, Congress moved faster than they ever moved for working Americans. But when seniors needed help affording medication, suddenly there was no money and no urgency. Vance changed that calculation. He identified specific budget lines where American tax dollars were being wasted and redirected that money to Americans who actually need it. Foreign aid to Pakistan? Cut. Subsidies to tech companies that censor conservative voices? Gone. Administrative bloat in federal agencies? Eliminated. Here's the decision every American needs to make right now, and your answer will determine what kind of country we're going to be. Do you want a government that sends billions overseas while Americans ration insulin? Or do you want leaders who put America first in every budget decision? Vance is proving that we don't need to raise taxes or increase the deficit to help working Americans. We just need to stop wasting money on everyone except the people who actually pay for government through their taxes and labor. The establishment's response reveals everything you need to know about their priorities. They're not angry about the cost. They're angry that money is going to working Americans instead of their preferred special interests. Comment below with America First if you think American tax dollars should help Americans before anyone else. Comment Globalist if you think we should keep sending money overseas while seniors choose between food and medicine. This choice defines everything. Either we have a government that works for Americans who built this country, or we have a government that works for everyone except Americans. The Democratic response to this program has been nothing short of pathetic, and their own polling shows they know they're on the wrong side of this issue. Chuck Schumer called the payments fiscally irresponsible, the same Chuck Schumer who voted for $113 billion to Ukraine while American seniors ration medication. Nancy Pelosi worried about budget impact, the same Nancy Pelosi who made millions in stock trades while voting on legislation that affected her portfolio. A CNN poll released Tuesday shows 73% of Americans support redirecting foreign aid to domestic programs like Social Security bonuses. Even 64% of Democratic voters approve of using money currently sent overseas to help American seniors instead. The establishment's problem isn't with spending money. It's with spending money on Americans instead of their global agenda. They had no problem finding $2 trillion for COVID programs that enriched pharmaceutical companies and big corporations. They had no problem with infrastructure spending that mostly went to consulting firms and government contractors. But $6,150 for Americans who worked their entire lives? Suddenly they're concerned about fiscal responsibility. Their hypocrisy is so obvious that even mainstream media outlets are struggling to defend it. When ABC News asked Alexandria Ocasio-Cortez why she opposed helping American seniors, her response was to talk about systemic inequality. Translation, she'd rather keep the system broken than let working Americans get ahead. The collapse is accelerating. Internal Democratic polling shows they're losing support among seniors by 18 points since Vance announced this program. Working-class voters who traditionally supported Democrats are asking why their representatives fight harder for illegal immigrants than for Americans who paid taxes their entire lives. Here's the part that's going to blow your mind, and it explains why the media is working overtime to ignore this story. Three major pharmaceutical companies, Pfizer, Johnson & Johnson, and Merck, quietly lobbied against the health bonus provision. They spent $2.3 million in the last quarter specifically trying to kill this program. Why would drug companies oppose giving Americans money to buy their products? Because they know that when Americans aren't desperate, they shop around, they compare prices, they ask questions about generic alternatives. The entire pharmaceutical profit model depends on Americans having no choice but to pay whatever they're charged. The $1,200 health bonus doesn't just help Americans afford medication, it gives them the financial freedom to make informed healthcare decisions instead of just accepting whatever their insurance company decides to cover. But here's the really interesting part. The same companies opposing this program received $31.7 billion in government subsidies for COVID vaccine development. They had no problem taking taxpayer money when it went directly to their profits, but they're fighting tooth and nail to prevent that money from going to Americans who might use it to shop for better healthcare options. The FBI is reportedly investigating whether these lobbying efforts violated foreign agent registration requirements, since two of the firms involved also represent Chinese pharmaceutical companies. So we might be looking at American drug companies working with Chinese competitors to prevent American seniors from getting healthcare money. This is the swamp Vance is draining. Companies that got rich off American taxpayers then work to prevent those same taxpayers from getting help when they needed most. Let me recap what just happened, because this is the kind of change that only comes around once in a generation. JD Vance identified $347 billion in wasted government spending and redirected it to Americans who actually earned it. 47 million Social Security recipients get $4,950. 59 million Americans get $1,200 for health expenses. No new taxes, no increased deficit, just money that was being wasted on foreign countries and corporate subsidies finally going to working Americans. The establishment is furious because this proves we never needed to choose between fiscal responsibility and helping Americans. We just needed leaders with the courage to put America first in every budget decision. If this video opened your eyes to how the system really works, smash that like button and share it with everyone you know. The mainstream media won't report this story honestly because it threatens too many of their advertisers and political allies. Subscribe and hit the notification bell because what I'm covering tomorrow is going to shock you even more. I've got internal documents showing which members of Congress personally own stock in the pharmaceutical companies that lobbied against your health bonus. We're talking about politicians who voted against helping Americans afford medication while personally profiting from high drug prices. The corruption goes deeper than you think, and tomorrow I'm naming names with receipts. You're not going to want to miss it. America is finally getting leaders who work for Americans instead of special interests. This is just the beginning.